Hi, my name is Ann Uttermark. I am the respiratory therapy manager here at Abbott Northwestern. I'm just going to do a brief overview of the heated high flow nasal cannula setup for you. This is an aerosol generating procedure, just to add a little bit of clarity to that. So when we talk about heated high flow nasal cannula, we talk about aerosol generating procedures. This is the device that we are referring to. So on this, you'll notice that there is a heater. This is the same heater that we use on a ventilator. And then there is an air and oxygen blender. With this, you get two things you can control. You get your FiO2, the amount of oxygen, you can control that, and you can control your flow, which is how fast it's being delivered to the patient. So this is our patient, Jenny. She is doing better today. She's been with us for a few days now. And her nasal cannula is on. If you notice that you walked in the room and maybe you thought you were set at 60%, now you see you're reading 70 or 75 or 80%, check that cannula. Make sure it's still sitting pretty neutral in the nares. If it's pinching, build up a backflow of oxygen and come back into your machine and read a little bit higher. So make sure that that's sitting kind of neutral in the nares if that's a change that you're noticing. But Jenny's doing well, and so we're going to titrate down her oxygen for her. She's been sitting in the high 90s, so we're ready to come down a little bit. She's on a 45% oxygen, and she's on a flow of 30. We want to titrate down our FiO2 first. It's on the side of our device. It's labeled O2, and then there's kind of this ramp-looking thing. So our O2, we're going to dial that back first. And to go down in our FiO2, I remember it as dial it back. And you're going to want to make just really tiny adjustments. It's going to change pretty quickly on you, so if you really crank it down, your oxygen is going to drop much lower than you had anticipated. So just make little tiny adjustments backwards until we get to, our goal was to go to 40%. So once we get down to 40% here on the front, that's where we want to go. If we keep tightening down, and she's still doing well, and we're down to 30%, she's still maintaining her sats in the mid-90s. She's doing great. We want to bring our flow down. We're currently at 30. We're going to go down to 25. So we're going to go to our bottom knob. Again, dial it back, watching your ball here. You're going to want to line the center of the ball up with the line. So the center of the ball is lined up with 25. She's now on 25 liters per minute, which is where we want her to be, and we're going to continue to monitor her. If you get some alarms on your heater, you will get an audio and a visual alarm. And so there's your audible alarm. Here's your alarm silence button. You can press that. And then you'll notice here that the lights will light up to tell you why it's alarming. So this one happens to say inspiratory limb, expiratory limb. All it knows is that it's unplugged. It's used to running on for a ventilator, so we only have one limb, but it's going to tell you it has a problem with both. And that's because it came unplugged. So these little pigtails are essentially the electricity for the heated wires in here. It's in this little 3-leaf clover shape. There's only one way to put it in. And so you just line it up with that 3-leaf clover and plug it in. Once it plugs in, your alarm's going to stop because you fixed the problem. Other common alarms might be for your temperature probe. Less commonly, this one can come loose. Just put it back in nice and tight. There's another temperature probe right up here, right by our patient. That one can sometimes come loose as well, and that'll give you an alarm. So if you just kind of squeeze that back in there and make sure that's in there tight, that should solve most of your alarms. If you're still having alarm issues, call your respiratory therapist. We'll get to you as quickly as we can to help you troubleshoot that. If you've noticed that your bag of water is empty, so we'll pretend this one's empty, like you do an empty IV bag. Throw the old one away, grab your new one, take the little plastic butterfly off, spike your bag, hang it back up, and it will drip feed down into your heater chamber. Hopefully that answers a lot of your questions. Have a great day.